Welcome to Discover Health, a White Mountain perspective. I'm your host, Dr. Tom Barela, and on this program we explore health issues that are prevalent in the White Mountains. Today's topic is drawn from the community health assessment that is driven by the Navajo County Health Department. Our topics today encompass teen health issues as revealed by this assessment. Our guests today include Allison Hefner, Community Outreach Coordinator for the Navajo County Health District, Heather Lucas, Teen Health Program Coordinator for the Navajo County Health District. We're going to start the program today with Allison and Heather. And I will say, Allison, you are intimately involved with the community health assessment. Why don't you describe how that health assessment is done and what kind of leads it gives you to address issues within our county?
I would be happy to. So the community health status assessment is done every 5 years. And what it is basically, the last one that we had done was in 2012. And ASU came in, or U of A came in and they helped us collect data from the community. And this data is demographics. It's as low income, where the low income populations are. It talks about some medical conditions like how many people are obese in Navajo County, how many people have heart disease. It gets down to a lot of even the mortality rate of infants. So there's a lot of information that it pulls from the community, and it's done in a report. And we take that report and we put together a coalition of agencies, organizations throughout Navajo County, and we sit down and we discuss the report. And we say, where are our numbers the highest? So through that, it's called a MAP committee. It's a Mobilization for Action, Planning, and Partnership. And we get down to the bone of it and say, you know what? Our obesity rates are not okay for our county compared to other counties out there, and we need to address this. So before I came into public health, they had this meeting and they came together and they said, we have 4 priorities that came out of the community health status assessment. And one is we don't have enough primary care physicians on this mountain, including special care physicians. So that was a priority we need to address. The second priority was we have too many obese people on this mountain, as well as people aren't moving. They're more sedentary. We got to get people up and running around. So that was the second.
You want us to exercise?
Yes. Yeah, I know. Dreaded exercise. So they had that as the second. The third was there is too much domestic violence in Navajo County, which sadly, and then that goes along with there's mental health issues here that need to be addressed. And we don't have, that goes back to specialty health care. We don't have those people to help address that in the community. And then the final one was pregnancy. Women aren't getting into the doctor in the first trimester. And that's where we're going to focus on that with this, because that's how this other stuff came about. But so with the pregnancy, we sat down and we thought, well, why aren't people getting treated in the first trimester with this pregnancy? And we came up with strategies, and that's what happened in our CHIP. Now, so you have the CHSA, Community Health Status Assessment. You get together, you meet with the MAP, the Mobilization for Action and Planning and Partnership, who come out with these priorities and these strategies, and they put them in a report, which is the CHIP. And the CHIP is the Community Health Improvement Plan. It all goes down, it basically goes down. And Summit does this as well. They have the SHIP, the Summit Health Improvement Plan. So other agencies and big organizations use the CHSA to get data to fix the issues in Navajo County. One of the things that came out of it was with the pregnancy, where we basically peeled an onion. We sat there and thought, how can we get women into see the doctor in the first trimester? And stuff started coming up, and it was just a collaboration of, well, a lot of people in Navajo County, it shows us in the CHSA, are pregnant at a very young age.
Wow.
And maybe they're uncomfortable with the fact, or don't know, or how do we educate them? Maybe they don't know they need to get a doctor right away. Well, how do we educate them? And so it came into teen health. Well, teen health goes in and we start educating at a young age into schools and talks about why, your body is important, and she knows a little bit more about that.
I'm sure she's going to discuss that in a little bit of depth.
That's not my area. So we basically get straight down to it. We came up with the fact that we think that people are not educated enough to know better. So we need to come together and figure out how we can educate them. One of the issues is it's very hard for teen health to get into schools to educate people. And we thought, well, how can we fix that? And we said, well, maybe Amy Lang can help us. And we brought in Amy Lang to
And we're going to discuss Amy a little bit later in the program today. So we're going to talk to Heather now and find out how your program got started. So tell us a little bit about teen health in our community.
So our program is a comprehensive sexuality education program that's funded through the Arizona Department of Health Services. We go into classrooms starting from 6th grade through high school, and we give comprehensive sexuality education, but it's teen health as well, so it's involving all risks. Our program covers, we deliver evidence-based curriculums that are medically accurate. They have been proven to delay sexual activity, increase contraceptive use among teens who are sexually active, helps with decision-making skills, communication skills. We go over drugs and alcohol and the risks involved there. We go over a lot of role-playing, which at first they don't like, but they get used to it and it really does help them. Our message is that education, knowledge is power, and they need to know. We go over puberty and we go over anatomy, the human reproductive system. A lot of the teens that we start to talk to, they don't even realize that one system isn't connected with another system. They don't have this information. It's up to districts to deliver sexual health in their schools. So if they choose that they don't want us in their school, they don't have to. So we are not in all schools, but it's very important. Our grant was given to us by ADHS in 2008, and our pregnancy rates reported in Navajo County were 381 in 2008. From 19 years and younger. And now, over the last 8 years, in 2013, the last report was 200 pregnant teens from 19 years and younger. So the message is getting across to some. However, what's alarming is that our STD rates are going up. And it's increasing, and it's dangerous, and they don't realize what they're at risk for and how it's going to affect them for the rest of their life. So, sexuality. What does that mean? We always go in starting with goals. What's important to you? Where do you see yourself in 5 years from now? Where do you see yourself in 10 years from now? We want them to start thinking of the future. Many teens just think of exactly right now, and that's it. And we talk about, we go into communication skills, we go into dating, and then we hit them with the puberty and anatomy. And it is amazing how much they learn in that segment, and they had no idea that that's exactly what their body, that's what that's for, and that's what that means. And we're giving them medically accurate information, and that's what we're delivering to them. So your program, what age does you start the teaching program in? It sounds like we've delivered it 6th grade, so almost 12-year-olds, 11 and a half, 12-year-olds. Yes, 12-year-olds through 18 or early adulthood. We also have a parent program to help educate the parents. It's a sensitive subject for many parents that they don't know where to start, they don't know how to start, and we want them to. We want these teens to go to their parents and get that message from their parents at their house. So we also offer parent programs, and they're not as successful, but we're trying. Most parents are resistant to these types of programs because they feel like that education should come into the home, from the home, yes. And yet, when you do these classes, my suspicion is that you find that a lot of that education isn't in depth or adequate in the home. Right. I think a lot of parents have the reservation that we're going to go into their child, into their school and teach their child what our values are. And I'm not there to teach them my values. Everybody has their own set of values, and that's what's important to each family. However, we're delivering the medically accurate information. The evidence-based curriculum that we use is approved because by law, that's all we can give them is medically accurate information. Just to give them more tools so that they can delay sexual activity, or if they are sexual active, they can lower their risks of STDs or unplanned pregnancies. Not eliminate, and we make that clear, but it can lower their risks. And just know that what comes along with all of that, it's a lot. There's emotional involvement that they'd have no idea about as well, and just the health risks alone.
I think it's important that parents understand that 400 pregnancies of children under 19 in our county is probably 30 to 40% of all the deliveries in our county. For example, Summit Healthcare delivers about 1,000 babies a year, and so 400 would be 40%,
right.
But I recognize the statistic is broader than that. Now, I think it's important also to recognize that other countries and cultures have also recognized this problem with young children's sexuality.
I've looked into it a little bit. You may even know more than I. I know that they are much lower. They have lower teen pregnancies in Europe. They have lower STD rates they're almost non-existent compared to our type of STD rates here. And I know their education starts from pretty much birth. 5 years old, they're learning things like good touch, bad touch. They're learning to communicate. They're learning their parts, their anatomy, and we tell even the teens that we talk to, why is it important we take care of our heart? What do you know about the heart? Because you have a nutrition that comes in and does a great job in these classrooms, and they deliver this message about what's important and the type of nutrition you need to take in to make our bones healthy and our heart healthy and our, so on and so forth. But they don't ever nobody talks to the younger group about the reproductive system. Why is it important to protect it? What is it actually there for? And so I think in Europe, my personal opinion is that because they start at such a low age, that those kids, they just know it's part of their body. You have to take care of it. You only get one health, and I think it's an easier open communication. And I think a lot of times, by the time we start coming into classrooms, there's a good percentage of parents that haven't started talking to their kids, and so their kids have heard things from movies or songs or the media or wherever they're hearing it, just from school itself, from someone else, and then they're not getting that medically accurate information. They're not knowing how to come home and communicate what they've heard because it's a little bit embarrassing, or it's, where if that open communication and education started early at home and or in schools, I think it would just be better for the teens and adolescents.
Yes, I absolutely agree. And certainly there's other countries that recognized this a long time ago, because STD rates in Europe have steadily decreased since the early 1980s. And certainly in our country, they're going just the opposite direction. Well, thank you for your presentation. It certainly was enlightening. Stay tuned for our second segment of Discover Health, where we will have Janelle Lynn, the Public Health Supervisor from the Navajo County Health District. Welcome back to the second segment of Discover Health. Joining us is Janelle Lynn, the Public Health Nursing Supervisor from the Navajo County Health District. Welcome to the show.
Hi, how are you?
I am doing good.
Good.
In the first half, we talked a little bit about teen pregnancy and how the approach is to help the sexuality of teenagers with an education program. I know that you have some of the statistics for the side effects of not having proper sex education, not having a proper approach to teenage sexuality. So, and I know this is probably an uncomfortable topic for a lot of people. Maybe even you.
Not me.
I'm glad it's not you, because we would like you to talk a little bit about it. So tell us a little bit about the statistics that we have in our county.
Okay, so I've been with the Navajo County Public Health since 2001. And ever since then, Navajo and Apache County have some of the highest STD rates in the state of Arizona. And typically we bounce back and forth with Apache County for that #1 and #2 ranking for gonorrhea and chlamydia.
Now, STD means sexually transmitted
STD
disease.
means sexually transmitted diseases. And when they assess those, they're primarily looking at syphilis, gonorrhea, and chlamydia. So the most recent statistics out are the 2014 data, because they're always a little bit behind in analyzing that. And in 2014, we last year in 2013 we had the #1 chlamydia rates. In 2014 we dropped to #2, and Apache County took back that #1 ranking. So in 2014 we had 702.6 per 100,000 of the population were infected with chlamydia, and a large number of those that are infected are adolescents aged 10 to 19.
All right, I want to take a second here so that the people that are listening recognize that chlamydia, gonorrhea, and syphilis may not be clinically apparent to the women when they are infected, and even in some cases they have no idea that they have it even when they don't develop some symptoms. Okay, so that makes it an even more important issue that we have some knowledge about how to approach this. And I'm sorry.
That's 50% of the time you're asymptomatic, which means you have no symptoms for a sexually transmitted disease. So there, you know, how many people are walking around with an STD that they don't even know they're infected? Also, if you go and you're infected with a sexually transmitted disease for a long period of time, it can affect things like your ability to bear children in the future. It increases your risks of infertility and things like that, as well as you're a risk to others in the population that you may be sexually active with.
Wow.
So another one of our statistics is we are #1 for gonorrhea. So for the 2014 data, Navajo County has the highest gonorrhea rates in the state of Arizona per population of 100,000. And we're really concerned because gonorrhea is becoming drug resistant. And there have been cases of drug resistant gonorrhea identified in Navajo County. There are very few medications left to treat gonorrhea with. And so if it develops resistance to those last couple of medications, that opens up a whole new can of worms and a whole new concern that we really need to
that's a problem for those of us that are physicians trying to treat it, because one of the side effects of untreated gonorrhea is sterility.
Yes.
And not bearing children can certainly be a problem if a teenager develops it before they've really come to the point in life when they want to have a family. Wow.
So our STD rates in the state of Arizona as a whole are high. I was just looking this morning, the CDC does a statistical report for each state, and they have released the statistical report for 2015 for the states. And for the state of Arizona, we rank 17th in the nation for primary and secondary syphilis. We rank 18th in the nation for chlamydia and 25th for gonorrhea. So our rates as a state are high. And then they haven't broken the 2015 data down by county yet, but for the 2014 data, we are #1 for gonorrhea and #2 for chlamydia. So it's really important. I think we need to take a different approach. Going back to what Heather was talking about, we need to become comfortable with where we are at with our sexuality, with having these types of conversations. We need to be having these conversations with our children and teaching them this isn't a taboo subject. Like Heather said, this is about your reproductive health. Your reproductive system it's an organ, and if we had a more relaxed attitude about it, we could teach our children the message from that perspective that we want them taught, instead of them learning it from somebody else. Teach them to be comfortable with their body. Teach them to be comfortable having discussions with their peers, with others. It just protects them in the long run. And as you guys mentioned, you know, the STD rates in Europe, they're practically non-existent because they have a very open-minded attitude and approach towards their reproductive health.
Yeah, I think I read somewhere where they were talking about the education of the children, at least in Europe, saying that their program was essentially aimed from the observation that sexual activity begins to rise significantly at about 15 years of age. And I know as a parent and as you know, as a physician, sometimes it's very difficult to talk to a 15-year-old about their sexuality, and yet, at least in Europe, it has made a significant, as you mentioned, drop in the STD rates in Europe. And that also affects their reproductive rates and their ability to have children later in life, especially from gonorrhea, syphilis, and chlamydia.
Right.
Okay.
So it's an overall approach, and we have to be comfortable with it ourselves. We have to be comfortable having those discussions with our children, and then we have to teach our children to be comfortable having those discussions with future prospective partners, with their healthcare providers, with their peers. And it's been found that it doesn't increase children's risk to have sex. It helps them. In fact, a lot of them choose to wait longer to have sex and be abstinent longer. And then if they do, they're more well informed and they can be, make better, wiser decision-making skills about their health.
All right, so we heard this morning that teen pregnancy rates are an issue, and an education program is for that. I'm assuming that for STD, there must be some kind of approach that the county health department has for public awareness.
There is.
For that.
So we have an HIV and an STD program at the county health department. First of all, we have an office in Holbrook, one in Winslow and one in Show Low. We offer free to reduced price, depending on your income situation, HIV and STD screening. So you can come in and be screened through us. Our nurses are all certified counselors, so they can take the counseling approach of, to help you identify your risk factors, reduce those risk factors, and of course, if you get a positive, to counsel you through that process and link you to care and treatment and things like that. We also work a lot with youth, and we teach them that you need to bring your parents in on this conversation. This is not something, you need to have this conversation with your parents. We give them tools on how to be more comfortable with that. We offer for them to bring their parents in with them, and we're happy to help facilitate that conversation if it's something that's uncomfortable for them. And you'd be surprised, a lot of them they've taken us up on that.
But they don't have to.
But they don't have to.
Okay, that's important.
By state law, by the Arizona state statutes, you can seek reproductive related healthcare services after the age of 14 without parental consent through us or any healthcare provider.
That's important information, and I thank you very much. But there must be an education program too.
Not in the schools. They don't allow us in the schools.
In the schools?
Yes.
All right, so how are we going to develop community awareness for the two issues that we've talked about today? And Allison, I think you have that information.
Yes. One of the things Janelle touched on is the fact that people are uncomfortable talking about it. And one of the things that came up is Cellular, the one, put up these billboards, and it had a girl on it, and it said Naked Mobile. And a lot of people were upset at these billboards. And when you have people in public health, when I talked to Janelle about this, I looked at the billboard and I thought, wow, this is awesome. This is great. Look at what they're doing. People have to talk about this now. And people were so upset, I couldn't get over it. And when we talked about it, Janelle was like, oh, it was a great opportunity to talk to my kid, right?
Mm-hmm. We're driving down the road. My daughter saw the sign and she made a comment. And it was a great avenue to move into an approach of, how do you feel about your body? Why does that, how do you feel, how does that sign make you feel? And we talked for about 20 minutes on a very open dialogue. Use opportunities to teach your children instead of being afraid.
That's how it should be. And it's not. And it was obvious that it wasn't, because it caused an uproar. So I reached out to Cellular One and said, we're thinking about I showed them the stats. I said, we're thinking about bringing this woman up here to start a campaign to talk and make people aware and start to educate. And they jumped right on board. And it's the Naked Mobile Keeping Kids Safe tour, because we're all about keeping kids safe. With STDs is something, like you guys said, it could take away the ability to have babies. It causes all these issues. So Amy Lang's coming in June. It's a tour where she'll start on the Navajo reservation on the 7th of June, and then the 9th, 10th, and 11th she'll be going through the White Mountains, discussing and if I can move by, discussing information to parents. She basically takes the sting out of the birds and bees, which is nice and comforting, I think. She has over 20 years of experience as a sexual health educator in a variety of settings, and she's coming here from Seattle. She calls it her experiential style educator, which means she's been hands-on since the beginning. She is a sexual abuse educator, experienced consultant. She has an in-depth knowledge of childhood and adolescent psychology, social and physical sexual behavior and development. So she's basically coming here to help us empower parents to teach their children. And so, like I said, she'll start now in Navajo Nation, and then she'll be in Snowflake at the MPC in Snowflake the 9th and 10th. And the 9th is professionals and first responders and teachers and doctors and nurses that we want to get in here because we want them to know what's appropriate for a child to stay at what age, how to deal with a child that has, you know, maybe a sexually transmitted disease to sexually assaulted or whatever it might be. We want to inform them and educate them.
So the program is essentially directed a lot towards parents?
It's directed towards parents the entire time.
Parents and adults.
We need advocates out of these parents to understand that our teen health courses from Navajo County Public Health are important to advocate for those to be in school. Get your kids signed up for that. STDs, we need advocates for coming in and doing these programs and getting checked. And
when does this program? You said June.
Yeah.
Early June?
June 7th, 7th, 9th, 10th, and 11th.
And where can parents get the information?
We're doing a campaign along the side with Cellular One. We'll be promoting it, getting that information out there. They'll hear it on the radio station. They can just get with Navajo County Public Health. I'm the organizer, Allison Hefner. They can contact me at Navajo County Public Health, and I can help them with all the information.
Wonderful program. I've known Amy Lang for a long time.
Oh, awesome.
But I think that this will be an excellent opportunity to get parents involved. We have teens involved. We have the public health nursing supervisor for the county. I thank you very much for your presentation today, and I hope that both the parents and the children will find it valuable. Thank you for watching Discover Health today. Remember, healthy habits lead to a healthy life.